seen the 18-year-old boys who use too many benzos, too many pills, and too much opiates, heroin, morphine, and by the time they're 20, they've got dementia. And then their body starts to just get old. I'm a GP. I've got 90-year-old patients who are fitter and stronger and look a lot better than some of my 30, 40-year-old patients. And I've been doing addiction work now for 12 years, so I have seen the decay. And this is not rare, this is common. We've had 3 patients go blind due to fungus infection in the eye. And even we've had a number of very pretty young girls who their eye shrinks up under the impact of the fungal infection and they become quite horrific actually.
We all know that the biggest drug problem in our culture is not heroin. The biggest problem is the abuse of alcohol.
Methadone's become famous and it's become the best accepted medicine. Unfortunately, the long-term effects is that you meet somebody at the age of 18 and you take them on to be a 40-year-old addict who's now addicted to heroin and methadone and any opiate. But each of those individuals have only got one life. And so you've accidentally taken the 18-year-old into a chronic addiction pattern, which is going to interfere with his enjoyment of life, interfere with his productivity, interfere with his relationship with the community around him.
Adolescence to early adulthood from about 16 to about 26 is a period of very active brain growth. Because of basically the chronic poisoning, then you not only damage brain function in the long term, but you've damaged brain structure in the long term. And that explains the extremely high rate. I mentioned, 40% for the major psychotic disorders and 70% or more for anxiety and depression before. The extremely high rate of serious mental disorders.
Clinical depression has increased tenfold since the last World War. Why?
Now everyone wants to be young and beautiful, but the cells that keep your body fit and strong and regenerate your tissues are actually stem cells, and all the addictive drugs, including alcohol and tobacco, but cannabis and opiates and the stimulants, knock the stem cells and knock them out. It's known that the rate of heart attack after smoking cannabis is, I think, 10 times higher than in non-smokers, and it also applies to opiates, we believe. Some of my patients have lost numbers of babies due to their drug use, and they've had brains which are not fully formed, brains which aren't there. So therefore there's a high fetal loss rate, there's a high congenital malformation rate, which I might add with cannabis includes no ears and no eyes. But if using them is really poisoning your brain, especially in that key window between 15, 16 and 26, and if it is not only poisoning our children, but poisoning their children, if you want to talk about civil liberties, that's fine. I want to talk about my civil liberties to be born without a habit, to be born without mental retardation, to be born without cancer, and to be born without congenital malformation. All my patients come to see me with regrets. They all want to be clean, they've all lived the nightmare, and they're all over it, and they all want help to get off it one way or another. They've mostly lost their jobs, mostly lost their money, mostly lost or almost lost their relationships, mostly lost or almost lost their families. A lot of them will come to me and say, I've shot 2 houses, 3 boats, 4 cars, and a couple of holidays up my arm. I think they've had their whole life stolen from them and their vision of what a life could be.
Naltrexone is the one drug where all opiate addicts become non-opiate dependent if you block enough receptors. They then have to go back and learn how to be honest, how to relate, how to ask for forgiveness, how to take an interest in themselves, how to take an interest in the person next to them, how to maintain relationships. And for the ones who started their heroin addiction between 12 and 20, there's a whole growing up disorder where they actually have to learn everything about relating to the people around them. You really have to put in a 5 or 10 year effort in assisting addicts to change.
The simple cold hard reality is that if I never take a drug, then I never have a problem with a drug. I can't have a drug habit if I never use the first use. The typical lie that is peddled is one taste won't matter. Well, if I never had a shot of heroin, I can't have a heroin habit. If I never had a toke on a bong, I can never get schizophrenia. My kids can never get cannabis-induced cancer.
violence of citizen against citizen. And we've got used to that on Saturday night. But that is a terrible sign of the collapse of a culture. We must deal with the alcohol problem in the midst of the whole of life problem.
Most patients, in my experience, who come to our clinic come through the door and say, look, I dread the idea of detoxing again, but I don't want to be addicted to legal opiates or illegal opiates, and I really want to actually get better.
You talk to my patients who've lived the nightmare and they all say to a man, don't go there, I wish I'd never done it.